guys, I'm Siobhan, an internal medicine and rheumatology specialist. Today, we're talking about a condition that affects roughly 1 in 5 US adults at some point in their life, and 280 million people right now around the world. It's a condition that affects women more than men, and in its most severe forms, it can lead to preventable deaths. And yet, we hide it behind smiley photos and glittery filters, and we don't talk about it nearly as much as we should. So today, let's change that and talk openly about depression. By the end of this video, I'm hoping that you'll understand that depression is far more complicated than a chemical imbalance in the brain that can be easily fixed with a pill, and that depression is treatable. We're gonna focus on evidence-based treatments that are low cost that you can actually start using today to start feeling better. But first, let's talk about what clinical depression actually is. It's normal to sometimes feel down, but when it starts to last longer and become more intense, and when it starts to affect your ability to do the things that you want to do in life, that's when it starts to tip over into clinical depression. Although you probably think of depression as a purely psychological or mental illness, which it is, people who are depressed actually feel their symptoms both in the mind as well as in the body. When I was going through medical school, I used the mnemonic SIGGY caps to remember the classic symptoms of depression. Changes in sleep, either sleeping too much or not being able to sleep, losing interest in things that you used to really care about, feeling guilty, feeling extremely exhausted both mentally and physically, difficulties concentrating, changes in appetite, either craving foods or losing your appetite altogether, psychomotor changes, so physically moving slower or being really agitated, and finally, suicide, so having thoughts of suicide or even actively planning it. Looking at this list, you can see that depression can look really different for different people, and that it can affect really every aspect of your life, from school to work, relationships, hobbies, sports, all of it. And it's definitely not something that someone can control or just snap out of if they think positively. So after hearing all of that, you might be wondering to yourself, am I depressed? Consider asking yourself these two questions. In the last month, have you lost interest and pleasure in things that you normally like to do? Have you been feeling sad, down, depressed, or hopeless? If you answered yes to one or both of these questions, it doesn't mean that you're depressed, but it does suggest that you're struggling with something, and it's probably worth talking to your healthcare provider to see if you might be struggling with depression. Okay, so this is the point of the video where I make a really important safety disclaimer. If you are experiencing thoughts that you want to end your own life, or that you want to hurt somebody else, this is serious. This is a medical emergency. So just like if you were having a heart attack, you wouldn't be booking an appointment in a couple of weeks with your family doctor. You need to go to the nearest emergency department right now. It's that important, and you are worth it. So if you're not at the point where you need to go to the emergency department, but you do want to get help, consider making an appointment with your doctor. I've heard from a bunch of you that, you feel nervous going to the doctor, or maybe you don't think it's serious enough, but you still want to talk to someone, and not just about mental health issues, but all sorts of different things. I was thinking we can talk about what to expect if you go to the doctor, so that maybe you'll feel a little bit more confident and prepared and feel comfortable going. When you go and see your doctor about depression, they're going to be generally thinking about 3 main things. First, could these symptoms be related to something other than depression? In other words, could there be another underlying medical condition, like low thyroid disease, or an infection like Lyme disease, substance abuse problems like high alcohol use, or even an autoimmune disease like lupus? Second, has there been some kind of trigger for this change, like a breakup or a loss? Could this be grief? Or was the person recently pregnant? Could this be postpartum depression? Or does it happen every single winter, and could this suggest seasonal affective disorder? And finally, how severe is it? The big question of risk. Is this a medical emergency? Do you have to send this person to the emergency department right away because you're worried they're going to hurt themselves or hurt somebody else? You can imagine, to get all of that information, your doctor is going to ask you a whole bunch of questions, and they may also give you a questionnaire, like the patient health questionnaire, which is made up of 9 different questions that can help make the diagnosis of depression. Then at this point, they'll likely start talking to you about treatment options and next steps. When I think about treatment for depression, I usually think about 3 main groups of treatment options: therapy, lifestyle modifications, and medications. And most people benefit from some combination of all 3. The most established evidence-based therapy for depression is cognitive behavioral therapy, CBT for short. The idea is that depression is maintained by inaccurate thoughts and beliefs about yourself, about others, and about the future, and those are usually pretty negative thoughts. And during the process of CBT, you learn to question whether those negative thoughts and beliefs are truly accurate. Let me give you an example so you know what I mean. Let's imagine that you're on a diet, and it's an extremely hot day outside, and you know that you have your favorite ice cream in the freezer. Maybe it's cookie dough ice cream, and you decide to eat a scoop. Then you might find yourself thinking, why did I do that? I can't stick to anything. I'm such a failure. Then you might start feeling down and defeated, and those negative thoughts just start taking over. So you grab the ice cream and start eating some more, and the cycle continues. Now let's think of a slightly different example. Maybe one where you've trained in CBT before. So you eat your ice cream and you have that feeling like, oh, I'm such a failure. But then you pause and you think to yourself, is that accurate? Maybe I'm being a little harsh on myself. I mean, it was just 1 scoop of ice cream. And in that moment, you're breaking the cycle. Sounds easy, right? But it takes practice. And get this, studies have shown that CBT is as effective as antidepressant medications. And if you do CBT plus you take antidepressants, it's even better. This is why CBT is such a great place to start in the treatment of depression. And if you're having any difficulty finding someone to do the therapy with you in person, there are also lots of great online options too. You know, when I was a teenager, I actually used a website called Mood Gym, and I still remember them talking about the cognitive distortions that they called wonky thinking, and it was so relatable. A lot of those lessons really stick with me even today. Honestly, I really believe that this should be taught in all schools. It's just so useful. I decided to reach out to Mood Gym when I was creating this video and ask if they'd be willing to give you guys a discount, and they agreed. I'm just thrilled. This is not a sponsored video. I don't get any money or kickbacks. I just want you guys to have a chance to try out CBT and see if it'll be helpful for you. The link and the discount code will be in the description box below, and it'll be valid until the end of October, so that includes Mental Health Awareness Day. If you decide to try it out, let me know how it goes. And I should say that although CBT is the best studied, there are other types of therapies that your doctor or therapist might recommend based on your particular situation, and those can also be really helpful. Okay, so then comes lifestyle modifications, things that you can do to take care of yourself. When you're unwell, you just want to curl up in bed, watch Netflix, and fall asleep. But with depression, this can paradoxically make things worse. The isolation of being alone with your negative thoughts and feelings can just feel like you're being sucked into a dark hole. And to combat that urge to curl up in a ball, we've got another really handy acronym, NESTs, which stands for nutrition, exercise, sleep, time for yourself, and supports. These are all really important lifestyle considerations for someone who's battling depression. People have different relationships with food when they're depressed. Some people crave food like carbs, while others completely lose their appetite and don't want to eat. The goal is to get back to a balanced diet, and most experts will recommend the Mediterranean diet as a good place to start. Personally, I find the idea of a gut-brain connection to be fascinating. There's actually a whole area of research where they're looking at how bacteria in the intestines may be affecting our mental health. This is still new and emerging research, but it really emphasizes the importance of eating well, especially if you're struggling with depression. Everybody knows that exercise is important, but you may be surprised to learn that exercise alone can be an effective treatment for mild to moderate depression. So if you do nothing else other than start to exercise consistently, you'll likely start to feel better. And some studies even showed that exercise was as effective as certain therapies and medications. Scientific studies haven't shown that one exercise is better than the other. So choose something that you like: walking, biking, swimming, group classes, whatever it is. And commit to doing 30 minutes 3 times a week. The key, and it's not easy, is doing it consistently. And I know when you're feeling depressed, you might think that feels impossible. So pick something small, something that you can do consistently, like walking around the block. Mostly, I just want to tell you, you can do it, even if it feels impossible right now. Getting enough sleep can be really tricky because one of the major symptoms of depression is insomnia. So you can't just tell someone, go to bed early, catch up on sleep, and you'll feel better. It's just not that easy. There are some tips and therapies out there that can help, like CBT for insomnia, having a routine before bed, sometimes gentle exercise, reducing screen time, and of course, medications. Which is why I think it's important to bring up if you're having sleep problems with your family doctor. And finally, the importance of making time for yourself and having supports around you. Just look at our recent experience with the COVID-19 pandemic lockdowns. I mean, we saw the two extremes. People who were at home, no time for themselves because they were living and working in small quarters with their families. And then you had the opposite extreme where people had no support, completely isolated at home, and both sides were struggling with their mental health and crying out for help. To recap, if I had to pick the top 3 things that you can start doing right now in order to start feeling better, I'd say 1, sign up for a CBT course, either in person or online. 2 would be start exercising, commit to 30 minutes 3 times a week. 3 would be start eating a really nutritious, balanced diet. Okay, and I've got to put one more in. If you're really struggling with sleep, then reach out to your doctor for help. If you've made it this far in the video, then take a moment to go to the comment section and leave a whole bunch of green hearts to show your support and solidarity for those suffering with depression. And now finally, we're going to talk about antidepressant medications. I really wanted to talk about all those other treatments for depression first because it's really rare for someone to take a medication, change nothing else, and feel better. It's usually a combination of all of it. The topic of antidepressants is huge, so we're going to focus down on a few key points that you need to know about. Antidepressants work. They don't work for everyone, and to be honest, I worry that the idea of a magic pill has been oversold to the public. So let's break down how this works. Most people who become depressed will recover slowly on their own without any treatment. But that can take months, even a year. And in the meantime, that can have serious implications in their life. They can fail out of school, lose their job, have serious impacts on their relationships. So to try and prevent that from happening, antidepressants are used to try and speed up that recovery process. But antidepressants don't work immediately. It takes about 3 to 4 weeks before they start having an impact, and 3 to 4 months before you see their full effect. The changes are often gradual, so on top of being depressed, you also have to somehow be patient to wait for these changes. If it's your first episode of depression, and you start feeling better, and you consistently feel better for months, then your antidepressant will usually be slowly weaned off. And most people are on the drug for about 1 year if it's their first episode. This is the ideal scenario, but it's not always the case for everyone. Some people experience really severe and long-standing symptoms of depression if they don't receive treatment. And in those cases, this is where medications can be really helpful. But when someone first becomes depressed, we don't have a crystal ball. We don't know how long they're going to be depressed for, which is why we'll usually offer a trial of antidepressants to see if they feel better. In addition to all the other things we talked about, CBT, exercise, nutrition, and making sure they have a safe place to talk about what they're going through. I think one of the fears people have is, what happens if I don't feel better with the medication? Please don't lose hope. This is when it's so important to go back to your healthcare provider because there are lots of different types of medications, different classes of medications that you can be switched to see if you have a better response. And beyond medications, there are non-invasive procedures like transcranial magnetic stimulation, which is basically when doctors use magnetic fields to stimulate nerve cells in the brain. So the bottom line is that there's lots of different treatment options out there. The key is finding out what works for you. And sometimes that means trying out different options before settling on the right one for you. So try not to lose hope in the process. And finally, we can't talk about depression without touching on suicide. Because for some people, depression is a fatal illness. And this is the horrible, tragic part of severe depression that we're desperately trying to prevent. The WHO actually lists suicide as the 4th most common cause of death between the ages of 15 and 29. That's way too high. If you're having suicidal thoughts, please call a suicide prevention hotline or go straight to the emergency department. I'll say it again, this is a medical emergency. Just like a heart attack, you deserve the same level of care. If you aren't sure what number to call, check out the description box because I've left some resources. And there's also a website where you can search up any country and it'll give you the right helpline to call. So after all of that, let's take a moment to remember how common depression is, affecting roughly 1 in 10 adults. Statistically speaking, it's likely that you or someone that you care about is going to suffer from depression at some point in their life. And that makes it personal for all of us. So we all need to tackle this together. Look out for one another, speak up, and start normalizing mental illness so that we can get the right information out there so that people can get the treatment that they desperately need and deserve. Depression is treatable, and nobody should have to deal with this alone. Thanks for watching. My hope is that this is just the start of an important conversation. Be kind to yourself, look out for those around you, and I'll see you in the next video. Bye for now.